Hi everyone, I'm Dr. Gauri Apte. The month of May is Mental Health Awareness Month. So today we're going to talk about perinatal mental health. And for that, we have with us Varadayini Gorhe. Varadayini is a pediatric sleep consultant and she's also a maternal mental health counselor. Hi Varadayini.
Hi, Gauri. Hi.
So, Vardhani, in recent times, there has been a lot of talk about postpartum depression. There have been references to it in pop culture, but it's not exactly the same as perinatal mental health or perinatal mood and anxiety disorders or PMAD, right? So, what is perinatal mental health?
Okay. People speak about PPD or postpartum depression, which is the period after the baby's born and
Mhm.
a year after that. But
Right.
perinatal mental health incorporates the time since the time you get pregnant to the time the baby is born. So,
Okay.
it's the 9 months
Mhm.
of pregnancy plus 1 year of postpartum.
Okay.
So that's the whole period or the duration of the perinatal period, and the mental health during this period of the mother is what we call as the perinatal mental health.
Right.
So we speak basically what comes under this is, an entire spectrum from, say, very mild symptoms of mood swings, mood, ups and downs, sleep
Right.
issues, to like, maybe, a very serious like clinical postpartum depression or
Right.
anxiety, or, depression or anxiety during pregnancy.
Right.
So there's that whole spectrum. So, it could be just small mood swings or anything which would be related to depression, anxiety, or mood during pregnancy or post delivery,
Right.
to, the whole clinical form of depression, which is
Got it.
through the pregnancy and postpartum.
Mhm. Right. So, knowing that it is a full spectrum of symptoms and feelings, why is it important to address this? Why is perinatal health important, perinatal mental health important for us? Why do we need to know about it?
Yeah, I mean, like we spoke earlier, like people have been speaking a lot about PPD or postpartum anxiety depression. But we also need to understand that even when the mother, like the mother to be, is pregnant, or a woman is pregnant, and if she has like some serious form of depression or anxiety or any mental health disorder during pregnancy, there is an effect on the fetus, not only the extreme form, but even like, minor ups and downs or there's stress, there is some form of, external stressor that's impacting her during the pregnancy. There is an impact on the fetus directly.
Hmm.
Like, there would definitely be some, issues once the baby is born, maybe, behavioral symptoms or mood symptoms even in the baby that is impacted. So, yes, direct impact is on the baby, and hence it's very important to address even mental health during pregnancy and
Right.
not only after. So, both are important. Both the periods in a mother's life is very important to understand whether there is any, mental health issues or
Right.
any ups and downs which is impacting her mental health.
Right.
So yes, recovery and addressing those issues during that whole period is very important.
Yeah, I think there's a lot of societal pressure on women that are pregnant or that have just had a baby to
Mm.
be happy all the time. Everyone will tell you this is the best time of your life. You should be feeling grateful. You should be feeling joy all the time. And I think that creates a sense of guilt for women that may not be feeling those feelings. So, what do you say to women that are feeling something other than just happy all the time during pregnancy or after having the baby?
I think it's pretty normal, Freya, because like pregnancy and postpartum, like having a baby is a very celebrated occasion. So
Right.
I think in any form of medium, like any medium, like be it books or movies, or we've seen that rosy picture of pregnancy and post pregnancy, having a baby, but it's normal to feel the bleach
Right.
or the other side of the spectrum. It's pretty pretty normal. I know many of our generation, like people will speak about hormonal imbalances, and that's why it causes a lot of ups and downs with your
Right.
mood, irritation. Yeah, it's that, but it's also like people go through ups and downs as it's normal.
Right.
The women who are pregnant, who have just had a baby, it's very very obvious that there's so much happen to their body that
Yeah.
it definitely impacts their mental health as well.
Yeah.
There will be ups and downs, so it's
Yeah.
pretty normal to feel a lot of varied emotions, like negative. It could be negative emotions, or it could be something what causes lethargy, sleep disturbances,
Hmm.
all those things. Pretty normal. So you
Yeah.
don't have to be like happy all the time.
Right.
It's not possible.
Yeah.
But there are women who also experience lot more negative emotions than
Right.
it's normally portrayed in the society. So it's
Yeah.
it's pretty normal, and it's okay to even talk about it to someone,
Right.
because that's what I think they are scared about, like talking,
Right.
because
Right.
don't speak up about it. Women
Yeah.
don't speak up. That they feel like, okay, why should I spoil someone else's mood because everyone's happy, and
Right.
why should I just tell about my feeling sad or feeling anxious about something to
Yeah.
someone who's already happy, or something in that
Right.
line.
Yeah.
So yeah,
Yeah, I think in fact there is a maternal mental health campaign called Speak Up When You're Down for this
yeah.
purpose where not that many women will speak about it and it's more common than we
Mm,
think. So for
yeah.
women that are feeling anxious or sad or stressed during pregnancy or after delivery, what do you recommend for them? How do they navigate through these feelings? What do you say they should do?
So, like I said before, maybe speak to a constant, usually your partner or your parents or a friend who you feel you can trust and open up to. If you still feel there's no one, you always have a maternal mental health expert or a counselor who can help you out, go through this period and navigate better. Basically, what a mental health counselor would do is they would at least understand more from the clinical side whether there's
Right.
something which is on the other side of the spectrum, or these are small mood swings or anxiety issues, and they would help them out with small interventions, like what we usually do. We
Right.
help moms out with small interventions which will help them go through that phase of short bouts of anxiety or short bouts of sadness if they're going through mood swings. But if it's a clinically, if they undergo a test, the mom would undergo a test which would help us understand whether they have any form of extreme, mental health disorders. That would help us also, help them with the required interventions. And that's the other side of the spectrum. But even with small mood disorders, or sorry, mood swings, we would help them with smaller self-care activities which are required
Right.
for, I think, every mom to be a new
Yeah.
mom. Yeah,
Yeah. No, I think so. Important takeaways. One, that it's much more common than we think. It's completely normal to feel, not just happy all the time. I think speaking to someone,
correct.
like you mentioned, definitely can help. And the most important thing is that moms or women being healthy is important for your
Yes,
baby. It's important for your baby when you're pregnant. It's important for your kids as a mother. I think
absolutely.
mother's mental health is very important. Thank you so much, Vardayini, for being here. If you guys have any questions or comments, you can leave them in the comment section below. You can also email us at info@fertilihealth.com. And thank you for watching. For women, speak up when you're down, and continue staying safe through this pandemic. Thank you, everyone. Thanks, Vardayini.
Thank you.